Hello everybody. Today I would like to present about the periodontal disease and health in general. So what is a periodontal disease and why is it important and how it related to the health in general? This is the information I would like to present today to raise awareness for everybody about how important of the disease. And first of all, I would like to introduce that, what is a periodontal disease. And according to the National Institute of the Dental Craniofacial Research, the periodontal disease is a range from simple gum inflammation to serious disease that results in major damage to the soft tissues and bone that support the teeth. The worst case, the teeth are lost. So, and according to the American Dental Associations, in the U.S., nearly 80% of the populations have, some kind of periodontal disease. So, is it really the number that, wake up everybody? Because it is a very popular disease and its effect to our health in general, and our health in general also affect to the gum disease. So first of all, I would like to show you what is, how it look like. This is, a sample pictures of different levels of the gum disease or periodontal disease. You can see it's, in the early stage, it's just, gums inflammations. So if you have a redness in the gum line, and also you can see the bleeding. If it's not untreated, properly and correctly, it's gonna be, more serious. You have it, the soft tissues gone and also the bone lost. And you can see here, if the teeth roots exposed, and it's gonna be end up that this teeth may be lost. So there is some idea about the periodontal disease and how it's related to our health in general. According to the many research and also in the Mayo Clinic, they list all of possible conditions that may link to the to the periodontal disease. First of all, is a cardiovascular disease. It is obvious. So many research that suggests that the heart disease is and a stroke may be linked to the inflammations and infection that oral bacteria can cause. And for the pregnancy and birth, the periodontitis have been linked to premature birth and low birth weight. With the diabetes also, the diabetes reduces the body resistance to the infections. So when you have gum inflammations, gum disease appear to be more frequent and severe among people who have diabetes. So the people have gum disease have a harder time to control their blood sugar levels. So it's two ways that the diabetes affects the gum disease, make it worse. And if you have gum disease, you make the diabetes or the body is have a problem to control the blood sugar levels. So also for the it's also, you cannot imagine that it's related to Alzheimer's disease too. Tooth loss before age of 35, according to the research, it may be a risk factor for the Alzheimer's disease. And in other conditions like immune system disorder that caused by dry mouth and eating disorders, it also causes the gum disease. And when you have a gum disease, you make that condition to be worse. So because of that potential links, it is very important that you are aware about this, you know, the effects of the gum disease to the health and the health to the gum disease. So the best way to protect you from getting gum disease and keep you to be, you know, in good shape, to be have a good health, you should brush your teeth and floss it, you know, at least twice a day. It is the first thing that you can do to protect the self. And also, you know, twice a year, please come visit the dental office for professional cleaning and exams. So with that simple thing that you can do to keep the oral health in good, and also can then dental professionals can give you the exams and the earliest diagnosis of the gum disease in the early stage, so that you can have a treatment right time and properly and protect, you know, the effects of disease for the long run. So thank you. That's all I would like to talk to you today. Thank you for listening.